Shall I go?
Yes, please, yes.
Okay, thank you. So hello and good evening, everyone. Welcome to the 121 session of Mero Eye Talks webinar. This is Ms. Solu Gautam signing in as your host for this session. And I'm so glad to have you all here today. Prior to the beginning of today's session, I request you all to drop your queries that you have in between the session on our live chat box. We will be discussing it later on our discussion session at the end of the webinar. So for now, without any delay, I would like to move ahead to inaugurate today's session. So today we are going to have a session on one of the topic which has been most demanded by our attendees, and the one which is emerging in today's world. To cover which we have a very special guest, Dr. Jasleen Kaur Jolly, and she is an MCOptom, a senior research fellow at Nuffield Department Clinical Neuroscience at University of Oxford, and she will be highlighting on writing a peer-reviewed article. So, Dr. Jasleen, I welcome you to our iTalks webinar on the behalf of Mero Eye Foundation and all our participants. Over to you, Doctor.
Thank you very much. So first of all, I would like to say how sorry I am to hear about everything that is happening over there, and I hope you're all keeping well, and thank you for attending. Also, please forgive me for my voice. I've been ill with a chest infection myself, so my voice isn't very strong. If there is anything that you don't understand, please don't be afraid to ask me to repeat it at the end, and I will be happy to do so. But thank you for your patience with me. And I'm absolutely delighted to be invited back to speak to you again today, this time on writing a peer review paper. So before we start, I thought it would be nice to get some audience participation. So why do you think it's important to publish a paper? What are your reasons for wanting to publish a paper? Please put them in the chat and one of the organizers will share them out loud. So I'll give you a couple of minutes to do that. Do we have any comments from the audience?
No, Doctor, not yet. So shall we read the comments later, some minutes?
Okay. Okay. So from my perspective, there are some key reasons for publishing a paper. One is to share your findings and add to the knowledge database of the world. This will help avoid duplication, which is particularly important with things that haven't worked out the way you would expect, or you've examined one concept in patients to help you in your clinic, but if you don't share it, then another clinic, if they want that same knowledge, they need to redo that same work. So it becomes important to share those findings to make sure that we're working as efficiently as possible and that we're all working together as a global academic community. And on this basis, because a lot of money gets wasted in redoing research that has already been done before and shown that something doesn't work. And this is part of the reason why the rules were brought in that any clinical trials, so I discussed this in my last talk with you about what is a clinical trial, basically anything that involves an intervention needs to be registered on a database such as clinicaltrials.gov, and then should be published whatever the outcome of that research is, even if it's a negative result. And then for you on a personal level, having the publications is an important marker of your track record. So, you know, as we always say in academia, publications are your currency, so it's proof of the work that you've done. So where do you start on that process of writing a paper? Because it can feel quite daunting at the beginning. The first thing is you start about the paper already when you begin your project. So what is your hypothesis and the main outcome that you're hoping to achieve? And quite often when I'm researching for a project and I'm doing my literature search to get some background, I will already have a manuscript draft page, which I'm then using to keep a note of the things I've read, along with where I read them, so the references, which then makes it easier when I go back 2 years later or whenever it is at the end that I'm writing that article. Next, you need to decide what type of article you're writing. So the most common form, excuse me, is a peer-reviewed research article. So original research that you've done, whether this be a clinical trial or a study. And then you can also have a review article, and there are different types of review articles, which I'll talk a bit more about later. You can have a short communication, which is used when you haven't got quite enough work to present a full research paper. You can have a case series or a case study. So case study is one case series is several cases, noting the same thing. You can have a comment on someone else's work. So if you've read something in the journal and either you agree with it and have more evidence, which doesn't justify a full paper, but would add to the validity of that paper, or you want to refute it, then you can write that kind of rebuff or letter to the editor. You can have a commentary, though those are usually invited. So there are multiple different types of article, and it's important to establish which one, because they have different guidance in how to write them, and also when you come to formatting them. So, and also you need to check, because not all journals take all types of articles. So if you've got a case series, you need to search for the journals that will actually accept case series, because not everyone does. Then you need to craft the story. And this is the most important bit. You need to be able to get your message across to the reader. And this means you do have to be a storyteller. You need to walk someone through the narrative. You need to create good figures to demonstrate your point. So again, I'll talk about that later on. On a political level, you need to, before starting, agree on your authorship list. And I'll talk a bit more about that in a moment. And then all the authors need to be involved in the content. And then finally, you need to format the article and then submit to the journal of your choice. And I put a stop here because this is quite a milestone, because so much work goes into getting that point. Whether your article gets accepted or not, I think it's really important to stop, breathe, and celebrate getting to that milestone. And then you've got to tackle the peer review process after that. So I'll talk about all of these steps as we go through this talk. And if you have any further questions, please feel free to put them in the chat, and I will try and answer them at the end of the talk. So author guidance, there's the ICJME author guidance, which is published internationally. And so if you just Google ICJME author guidance, this whole document comes up, and I've literally just screen grabbed a section from the beginning of this document, which tells you who is eligible to be an author. And the authors need to meet 4 criteria. So they need to make substantial contributions to the conception or design, or the acquisition, or the analysis, or the interpretation, or all, and be involved in drafting of the manuscript. So if anyone is involved in actually doing the work, you need to give them the opportunity to be involved in the manuscript. If they decline to be involved in the manuscript, then they don't get to be in the authorship. All authors need to then approve the final version, and they need to be held accountable for their parts of that work. So that, and more journals nowadays are asking for you to specify who in your author list did what, so that they can make sure people meet those criteria. So this is always important to discuss before you embark on any work, and also deciding who's going to go first, who is generally the person who does the most work on the actual manuscript as well. And the person who goes last is the senior author. So the person overseeing it, who might have brought in this idea and who has kind of been the one pushing things forward potentially. So I mentioned there are lots of different article types. So a clinical trial needs to be pre-registered on clinicaltrials.gov, as I've mentioned earlier and in my last talk as well. You need to have an ethics statement. So you need to give the details of the ethics review, you need to give the NCT number from your clinicaltrials.gov registration, and you need to say that your researcher did the Declaration of Helsinki and that all participants gave consent. Then you have your content, generally an introduction, a methods, a results, and a discussion, and then a conclusion, which talks about what impact that work is having on the field and on patient care, and what you need to do to take that forward. A clinical study, so again, I talked about the difference between those in my last talk to Mero Eye. So the clinical study needs to contain the same ethics statement, and you get the content, which generally follows the same principle. And then you talk about the implications of that work, the importance of that work, particularly for clinical trial setting or for clinical care. So you need to make it really clear why you've done this work and what it actually means, you know, how you can use it to move the field forward. A systematic review is a very specific type of review. And like the clinical trials, it needs to be pre-registered on Prospero. So systematic review is saying that you're reviewing all of the literature very thoroughly to answer a very specific question. So for example, it might be, how does latanoprost work for glaucoma? How effective is it at lowering IOP? So then what the systematic review does is it takes all the evidence base in the literature that investigate that question, and it puts them together, often with using a meta-analysis, which is a specific type of analysis that is often included in many stats packages. And with that, so you've got your introduction, then your methods is basically a detailed description of your search strategy, including all the terms that you used, and then your results with your meta-analysis, and then your final conclusion should be like a solid foundation for what clinicians should be doing for clinical care moving forward. There are other types of reviews. So the one I like that I've used most commonly myself is a scoping review. So this isn't a systematic review because it's not saying it's going to be all encompassing, but especially in a new field. So I work in gene therapy, and gene therapy is a very new field. So we don't have enough information to do a systematic review right now. So I've done a few scoping reviews where I've looked at the field and say outcome measures and how that field is developing. What are people doing? What are the gaps in our knowledge? And this kind of review often happens also in conferences where we, from new fields, will club together and say, okay, we need to start organizing ourselves so we can compare work going on across different fields. And one example of this is the HOVA document, the harmonization of outcome and vision in eye research, which is used for really low vision research, and that stemmed from the bionic eye, the electronic chip implant, various projects that were happening around the world. And from that came out guidance about where are the gaps, how to define new outcome measures, and what you needed to report. Excuse me. And then there are several other article types, as I've mentioned before. So you need to check the author guidance for each individual journal carefully for those. Now, to help you with all of this reporting, there are several checklists, reporting checklists. So the big one is Consort for clinical trials. And a lot of the journals, especially the higher quality journals, will require you to submit this checklist. So if you just Google Consort checklist clinical trials, you will find the original paper and a downloadable checklist, which you can then fill in. And whenever doing a clinical trial, I recommend doing this from the beginning. So you make sure you collect all the relevant information from the very first start, and that way you don't miss anything when you come to write up the final paper as well. So the consort has several different iterations on different types of trials. There's even a version for Chinese medicine. I haven't been able to find one for Ayurvedic medicine, but maybe that is something that could be developed by you guys in the future. For systematic review, you have the PRISMA guidelines, the PRISMA checklist. And again, when you're doing a systematic review, a lot of the journals, especially the higher quality journals, will expect you to submit this checklist as proof that you've done things properly. Then for PROMs, patient-reported outcome measures, which used to be more about questionnaires, you have the SPIRIT guidelines, but the SPIRIT guidelines now have an extension for AI. Oh, and PRISMA does have one guidance recently published for scoping reviews as well. But SPIRIT now has one for artificial intelligence mediated research. So again, to try and bring some standardization across the field, so people are reporting the important things that mean that research is comparable and it's giving all the relevant details. And then hover, I've mentioned, is the low vision one. And there are several others as well, but those are the big key ones. And just to give you an example of what they look like, so this is the consort flow diagram that any clinical trial paper should really have in there, because information about the dropouts and the people who didn't want to take part can also provide important information about the clinical use of that intervention. And this is an example of the PRISMA diagram. Again, it's just to make sure that what you've done is systematic and all-inclusive. Okay, so as I've said, the key thing is craft your story. What is it you're trying to tell? It's very tempting to just put in a huge amount of information in the paper, but then the important messages often get lost in there. So you need to really walk someone through your logic. And sometimes this can be quite difficult to do, because when you've spent so long in a project and your head's in it, and you forget what isn't public knowledge and what you've developed from being involved in this work. So it's really useful to get your co-authors in writing this from early on, and sometimes even showing it to someone who's had nothing to do with the work to make sure that you're not drowning out the important things. So some important pointers here: make it clear what you were doing and why. Why did you choose to solve this problem, and how did you look at the problem? Then you need to give enough details in your methodology that someone else could repeat your work, because otherwise we get the repeatability crisis in science, where results are not repeatable. A meta-analysis relies on repeatability, so that's quite an important factor in research we do. Don't be worried about being honest about the limitations of your work, because someone might see that and go, oh, I could do something that's complementary to this, and therefore build on your work. So be honest about that. It's not a failing. Every piece of work has strengths and limitations. And so it's important to talk about your specific limitations for you. Avoid abbreviations. Now, because I do a lot of multidisciplinary work, I used to use abbreviations a lot when I first started, because I was like, oh, I don't want to write this out in longhand again and again. But actually, when you do multidisciplinary work, it makes it very difficult to read papers from other fields. So it's okay to use some abbreviations, but try and keep them to a minimum, and try and keep them to the most common ones. And everything else, it might be a bit of a pain, but write out longhand. It will make your paper so much more accessible, because what you need to remember is not everyone reads your paper from start to finish. Most of the time, people are skimming through and then only reading it in detail if they need to repeat it, or if there's something they need to check. So you need to be able to not put them off when they're skimming through and attract them in. Avoid very long sentences and use understandable language. Scientists sometimes have a habit of trying to make things sound really complicated so they can show how clever they are. That's not a good strategy, especially when you're doing multidisciplinary research. You need to make it understandable to anyone so anyone can pick up the concepts that you're applying. And that is actually a better sign of intelligence, because if you can explain something that's really complicated in simple terms, then you really understand it and you have amazing communication skills. So don't think you have to use lots of terminology and long words. You don't. Make it as understandable as possible. And it's important to always refer to other people's work, but try not to be overly critical of them. You can be tactful about when you're identifying maybe a limitation in someone else's study. Limitations are not bad. It's okay to flag that up, but you can do it in a nice way and talk about maybe why they had that, and that's understandable, and that's why you've stepped in. So, because you don't know whether one of your peer reviewers, when you go through the process, might be the person you're criticizing. And if that's the case, they're going to give you a really hard time. And you really want to avoid that. Figures are super important in getting your message across. I mean, this is just a sample of the kind of figures you can have. You can have so many different types. So it's important to think carefully about what are you trying to convey, and then make sure you have all the relevant information to get that message across. So these are some examples from some of my previous papers. And here you can see I've got 95% error confidence bars. And because they're quite narrow, that gives you more confidence in that correlation. And then normally I would put the R value and the P value on the graph itself. There are lots of new types of plots around now. Excuse me. Some of these are like violin plots, pirate plots. So this is a violin plot where it shows the spread of the original data, as well as the median and the interquartile range. So a box plot would give you these three lines, and this, but it wouldn't give you the spread. But the spread provides quite a lot of information. So actually, I'm becoming more a fan of these kind of plots that show you the summary data, as well as the individual spread of the data. And then you can also do individual data points. This is from Color Vision, 100 hue plots, where I've then color coded. So this, each line here is one individual eye, and I've color coded each of these points to show how abnormal it is. And that's quite interesting. Like also in this paper, I showed the summary plots as well and the statistics, but it's quite nice to actually see the raw data. So you can see that there's no clear pattern, but you can clearly see in the patient group up here, there's a lot more red and orange, which is abnormal compared to the control group. Okay. And then remember, when you're labeling figures, you need to have a full description. So the rule of thumb is that from looking at your figure and reading the legend, people should be able to fully understand what you are showing without needing to read the paper. So you don't want to be too long, but you need to give enough detail and show any abbreviations that you've used so that people can make sense of that figure. If that's not done, your reviewers will comment on that. And it same goes for tables. You need to list out all the abbreviations, even though they're in the text, and you need to state clearly what it's showing, so people don't necessarily need to go back and read the paper to understand what you're showing. Remember, you don't use figures just for the results section. You can also use them for showing your methodology. So for example, here, I've shown how we did this particular measurement on this autofluorescence image. So I'm giving the reader enough information that they know exactly what I've done. And it's much easier to see this than just reading the description in the paper. Also, this shows how the disease manifests, so it gives you a lot more information that way as well. You can also show images of machines, especially if they're not common machines or if you've adapted it in any way, because we always say a picture speaks 1,000 words, and it can make it clearer what you've done. And then you can also, oh, my computer is frozen. 1 second. Sorry, my computer's just frozen. But what I was going to show next is you can also show your methodology as a flow chart, which can be quite helpful. So when we looked at the new visual acuity testing paradigm, for example, here we go. What we were able to show is exactly what paradigm we followed, which makes it then really clear. And if anyone wants to replicate that, they've got all the decision trees there, so then they know which direction to take. And it's often easier to show it like this than try and explain each step in the method section. So I do summarize this in the method section, but then I refer to the figure. So when you come to, so you've got your content there now. You've written your paper, you've got your results, you've got your story. You now need to format it, ready for submission. And this, don't underestimate the time this takes. This can take a long time. I have spent 2 days or more sometimes on formatting according to journal requirements. So first thing you need to do is choose which journal you're going to submit to, because they all have very, very different requirements. And this can be based on a number of different factors. So for me, the most important factors are, where am I going to get the most relevant audience? Who do I want to read this? Do I want clinicians, other researchers, maybe pharmaceutical companies? Who do I want reading this work? And that will help you decide the journal. Also impact factor, because the higher the impact factor, the harder it is to get your journal in there. They expect a very different level and much more depth and much more information. So if you've done a smaller study, then I wouldn't recommend going there, because you increase your chances of it being rejected, and then you have to format and keep going through that process. Look at who is publishing relevant content, because that can sometimes direct you to where the relevant audience is going. Look at which journals are respected. Be really aware of predatory journals, and I'm going to show you that a bit later on. Also look at the publishing fees and open access options. So this is really important, particularly when you're working with funding bodies, because a number of funding bodies, particularly here in the UK, have now said they're not going to pay for journal articles in specific journals because they don't meet their open access requirements. So if you're working with a partner who's funded by one of those funding bodies like the Wellcome Trust, then there are certain journals you won't be able to submit to if those individuals are then co-authors on your paper. So even though it might not affect you directly, it's important to be aware of, because it will affect your co-authors. And publishing fees can vary hugely. So some journals just do a set fee and then everything's open access. Some journals have a dual option, so you can either pay no fee or a limited fee, and then it's under an embargo for like a year, 6 months, whatever the embargo period is. And then it becomes more open access, and other journals will allow you to choose which option, so you can pay more to go immediate open access. And some journals will actually support you putting an author prepared manuscript on PubMed, which is a way of going open access and meeting open access requirements from funders. Your keywords are really important, as are the synopsis, procedure, abstract, and title. These here are how your article is going to be found. So it's very easy to think, oh, I'm so near the end. It's just 2 sentences. I can't be bothered. But actually, this information is going to determine which searches your article appears in. So again, it's about getting to the right audiences. So with title, some people tend to go for more comic titles. Some people go for titles that explain exactly what they're doing. Basic science research tend to put the result in the title. Clinical work tends not to. Research has found that shorter titles actually tend to get cited more. So, yeah, so it's good to spend some time thinking about what you think is an appropriate title. And then also the keywords. So what does your article relate to? And generally they recommend having 5 keywords. Sometimes you can have more. I would never go less than that, but you want to try and encompass as many aspects of the work as you can within those keywords. And then again, the abstract, often when people are screening for relevant articles, they'll look at your title, your abstract, and your keyword. So your abstract needs to not be overwhelming because you have a limit on how many words, which usually varies between 200 and 300 words, depending on the journal. So you haven't got space to put everything in there. You just want to hone in on the really important points, because then that means that the right people are going to look at your article. Some journals want you to have a synopsis, which is like a 30 character summary of what it's about. Other journals want you to have a précis, which is maybe a 2-sentence summary, which is what appears on their contents page. But these vary from journal to journal. So before writing those, do check out the journal that you're planning on submitting to. And if you end up having to resubmit the paper, which again I'll talk a bit more about, then you need to do all that reformatting. And some journals nowadays actually have their templates, and they just want you to transfer your article into those templates. And actually that's really handy. It makes formatting a lot easier, because some journals want line numbering, some don't, some want double spacing, some don't. So you need to look at all of those little details. Some want the figure legends in the document, main document. Others want them at the end. Some want, they all have different regulations for how to upload things, and your figures also need to generally be uploaded separately and need to meet certain criteria. So the DPI is a big one, because if you haven't got a high enough DPI, you're not going to have good enough quality. So I often use the program IrfanView, which is free to download, which allows you to change the DPI and change the resolution of images. And I find that really useful. But also the size of images is quite critical. Every journal seems to want referencing in a different way. Some journals helpfully provide an actual downloadable referencing style, which you can plug into your reference manager. So when you're writing a peer review article, it's really important to have a reference manager. And this is one of the first things I actually get even my undergraduate students now to learn about for their assignment, because it makes life so much easier and it's impossible to work without one. So examples of these are Mendeley, EndNote, Zotero, which are probably the most common, but there are plenty others. And if you have the same reference manager as your co-authors, then you can all edit the references. If you don't, then you can't. So Mendeley is free, Zotero I think is free, and it has a free version which is limited, and their full version is paid. So check the preferred style, and if they have a sample that you can use, then that makes life easier. Be careful what you cite. So you should not be citing anything that's not scientifically robust. So you should not be citing newspapers or magazine articles or anything like that. Try and find the original source document. If you're citing reviews, if it's a thorough review, like a systematic review or an intense review, that's fine. If it's not, then you want to try and go back to the original articles as much as you can. Be careful who you cite. Be thorough in making sure you cover enough information, because if you miss out some key work and that person that you've missed out is reviewing your paper, they're going to be very unhappy, and that's going to put you on a bad footing for the review process. even when you've got a citation manager, don't assume that your formatting is correct. Always go back and double check it, because reviewers do check these things, and it will simplify the process when your paper is accepted later. And also make sure you're citing correctly, because as a reviewer, we do sometimes go back and double check papers that we're not sure about that being cited, to make sure the interpretation you've given is legitimate. And when you're citing, always cite in your own words. Do not copy and paste. And same with figures, you must not copy and paste, because that's copyright infringement. And when you're doing your final formatting, I always tend to go back and look at other articles from that journal, because sometimes like your citation needs to be before the full stop, sometimes after the full stop. Some journals allow you to have citations mid-sentence, others don't. So sometimes looking at other articles and seeing what they've done can be helpful. And it can also be helpful to see their writing style, because different journals like different writing styles. So on the front page, you need a number of pieces of key information. So your title, your author list, your affiliations, your corresponding author details, financial declarations, conflicts of interest, author contributions. Some journals require your word count, not everyone does, and also keywords. So here's an example of one of mine that's recently, so you can see the title there, and then you can see all the authors. And in this particular work, two of us were joint first authors, and I've made that clear here. And you can look at the symbols required by the journal, because they do vary. And then, of course, you also denote the corresponding author. So that's the person who needs to be contacted for any questions about the paper, and then who funded the research, and the various people involved, and what type of article it is. But all journals are slightly different, so always look at the author guidance. So I mentioned predatory journals before, especially once you start publishing. Getting contacted by predatory journals is a big problem. I get daily emails from predatory journals and predatory conferences. These are not PubMed indexed. They charge you huge amounts of money. They don't do proper peer review. So whenever there's a journal that I'm approached by to contribute and I don't recognize the name, I go to this website, predatoryjournals.com, and I look up individual journals as well as publishers to make sure that I'm not helping to contribute to the problem, and I'm not going to get stuck and end up being forced to pay lots of money. So do choose carefully. Okay, so you've got your article, you've written it with your co-authors. What happens next? Well, you need to submit it. And as I said, you need to take time to celebrate that submission. After that submission, it goes to an editor in the journal, and the editor decides, is this going to go out to peer review, or do I reject it straight away? If you've rejected it, it doesn't necessarily mean it's a bad article. It might just be that it doesn't fit quite well enough within the scope and the importance of the journal, or that they feel it needs too much revision as it is at the moment. And the editor will usually give you some guidance, and then you can use that guidance to then try it the next place. And it's not uncommon to have to go through several journals. I think the most I've gone through is 3 to get an article accepted. So if it goes out to peer review, then it can either be declined to revisions, minor revisions, or accepted. Though to be accepted without revision is quite rare. So it tends to be major or minor, or just decline. If it is declined, again, use that information they've given you. It will make your paper better. Incorporate that into the next draft. Decide where you're going to try to submit it next, and send it off again to go through the process again. When you get the peer review, it can be really daunting, especially at the beginning when you don't have a huge amount of experience with them. Even now, I've got 44 published papers, and I've got several more in review at the moment, and I'm a reviewer for several journals. And even now, I find getting the review back quite stressful. But what you have to remember, these are volunteers that have given their time to make your paper better. So it's really important that you're polite and you don't react straight away. So quite often what I do is I'll read through what they've said, and then I'll put it away and I won't work on it for a few days, and I'll come back to it later on. And when I'm feeling a bit calmer and have had time to process the information. And when you read it a second time, quite often you realize that the comments aren't actually as bad as you thought and are much easier to address than you thought. So then you need to respond to the peer review, and you do this by amending the manuscript, clearly highlighting all the changes you've made, either track changes or highlighting with a color, and also writing a letter, which is a point-by-point response. Always thank the reviewers for their effort, because as I said, they're doing this in their own time. No one gets paid to do this. Many editors don't get paid either. You need to make it as easy as possible for the reviewers. So literally take each and every comment they've made and write your response, and then write clearly where in the manuscript you're going to find comments. Even if you don't change anything because you're defending something you've written, you need to make a change in the manuscript, because what you need to remember is that the reviewer is like your average reader. If they've misunderstood something, your other readers are also going to have misunderstood something. So you need to make that clearer. It's up to you as the writer and as the communicator to make that clearer. I try and include line and page numbers to make it easier for the reviewers to see. And if I'm not changing something, if I'm not doing what they asked, I justify why. And I don't just say, no, you're wrong. I give a nice considered argument. You can have your own references as well. And I thank them for their perspective and show that I've considered it and I've taken it on board and try to really understand where they're coming from. So again, just to give you an example of one of my previous ones. So, I thank the editor and the reviewers there. And then literally in italics is what they've written. I've literally copied and pasted that from their email. And then I have responded directly to the reviewer. So this is only part of my response. But if you'll notice, thank you for your comment. This was my justification. This is what I've changed. Here's the line and page number where I've changed it. And this is the exact phrasing of the new phrase. But I also highlight it on the main as well, so they can see clearly. And I do that for every single response that I get. Everything needs to be accompanied by a change in the manuscript, even if it's one word. Okay, so that's the peer review process. So there's a couple more things I just want to briefly mention. I'm not going to talk too much about them, but preprints are becoming really popular. So you can see the number of papers going into preprints. So this is when, before the peer review process, you can put your initial preprint in a repository, and there are loads of ones out there. I think BioReview is probably the one I see most for our kind of work. Most journals now allow you to have a preprint. These are not peer reviewed, so I try and avoid citing them, but it's an interesting way of looking what's happening in the field. And also it's an interesting way of getting information out there quickly, which has been really important for COVID. So this figure is from a paper that was looking at the information flow for COVID-19, and why things were able to move so quickly was partly because of the number of preprints. So the orange bars are preprints and the blue are peer-reviewed articles. And because of the delay in the peer review process, because it can take months to get to that point, the preprints can be quite helpful. However, you must remember it's not peer-reviewed, and peer-reviewed does make your journal article infinitely better. I don't think I've had a single article where I haven't thought at the end of the peer review process, as painful as it can be, that my article is not better. So especially at the beginning, you may be hesitant about putting out work that you don't feel is quite polished. The other thing that's coming in as part of open science is registered reports. So this is where, before you even start the project, you write up the idea and the design, include the statistical analysis you're going to do, and you write this comprehensive report about what you're going to do. This is for clinical trials, not for studies. and then you submit that to a journal. Quite a lot of journals are now accepting this, so well over 250 years accepting this. And if they accept your registered report, they are committing to accepting your final paper as well, no matter what the result of it is. So you have one peer review here of your pre-registered report, and then a second peer review of the final article, but the final article will be accepted if your registered report was accepted. So for clinical trials, this is being encouraged to encourage openness and transparency and reduce fudging data or data mining to get positive results, because it shows that you thought really carefully about what your hypothesis is and what your analysis is to look at the results you need. So how can you improve on writing your papers? Present at conferences, because that's a really good way of making you think about your story and your narrative. And as you talk through people in conferences and hear the questions people have, that can help direct your discussion writing and the narrative that you shape in the end. Organize informal journal clubs to critique papers. So we do this a lot. And I find this really helpful, because hearing how other people have read things, or things you're not sure about, things that are limitations, or things that study papers have done really well, you know, sometimes other people's perspectives can be really, really helpful. And practice, of course. So, you know, after my 40 papers, I'm getting much quicker and finding it easier, but it takes a lot of practice. Read other articles. But the key thing here is work closely with your co-authors. So different people work in different ways. Sometimes just having, like, making a start, because that's the hardest thing. And then, you know, if you get sick of it and you reach a roadblock, sending it out to someone else who can expand on it, and they can send it back to you and expand on it. And you send it back and forth 50 times, can reduce the stress and burden on one individual and help the creative juices flowing. Sometimes with some of the people I work with, it works really well if you both just grab a drink, sit down in the cafe or in an office, and you spend a few hours just writing it together, and you can do your thinking out loud, think about the phrases and the wording that you're using. And I quite like doing that, but not everyone does. But make sure that all of your co-authors have input into that paper. So work out what practices work best for you. And the more you read, and the more when you read, you're critically appraising them. So you're taking on board how they're written and trying to keep tips, particularly for ones that either do really well or do really badly. Then that's really helpful. And it'd be nice if you can write in the chat any papers you think are particularly good and why you think that is, because then as a group, you can maybe develop a knowledge base of good papers and get an idea of why that is. So final lessons: short and succinct is the best. The word limit is not a target. If you're under the word limit, it's always better. Do not go over the word limit. If you're over the word limit, you have to make the effort to cut it down. Keep the paper focused. If you've got interesting things that were on the side that aren't enough for its own paper, put them in the supplementary information. Do not put them in the main documents. And supplementaries, now that everything's digital, supplementary information is easily accessible on the journal websites. Think carefully about the narrative. You really want to grip your readers so they're looking, so they want to know more, and they are following your logic and understanding what you're trying to tell, and they can take home that message and then apply it. So that really is the most important lesson I can give you. But one very final piece of advice: computers can be a pain, and they will fail at the worst moments. So constantly back up your work, because there's nothing worse than having worked several hours or several days on a really nice paper, getting it looking lovely, and then losing the work because your computer fails. So back up constantly, and I can't stress this enough. And with that, I'm happy to take any questions, and apologies for my voice. I hope you were able to understand everything that I was saying.
Yeah, doctor, we could understand all those. And thank you so much for such a wonderful insights. So moving forward, we will take some of the questions. So, shall we begin?
Yes, go ahead.
So, Doctor, we will be displaying all the questions one by one on our screen. So, we just request you to go through it. Our first question goes like this.
Okay, so if there's the best way I like to start is, what is my clinical problem? Is there enough work that's been done out there to answer this question? If not, then you know you're going to do the study to do that. If there is lots of work out there, has anyone else written a review? And does that review answer your question? If not, then that can be a really helpful starting point. Yeah, writing a review to kind of put a gap, plug a gap in the market, as it were, or in the knowledge base, I should say, is the best way to start. Yeah, I always include a cover letter. That's a good question. I should have included that. So I always include the cover letter. You do not want to make the cover letter too long, and you don't want to just restate what you've already got in your abstract. So what you're trying to do, so I would first of all say, thank you for considering this piece of work, then explain why it's important. So your cover letter ideally should be less than a paragraph long, because journal editors can get really overwhelmed. They get hundreds and hundreds of articles. So you basically want to sell your article. Why is this so important? And why does it fit within the scope of that journal? So you're showing that you've paid attention to what they want from you as well. Next.
So yeah, I hope that answers the question. So moving forward, we have next question.
So the Vancouver style is one style of reference. So there are lots out there. The Frontiers journals have their own. The other common one is AMA, so the American Medical Association. Nature have their own. Another one is IEEE, and I forget what that stands for. So Vancouver is just one of those different styles. So you need to look within your, in fact, I wonder whether I can share my screen and show you, because that might be easier. So you need to look at the journal article and see the journal reviewer guidance and see what they prefer. So if I just show you, so I'm a fan of Mendeley. I'm just going to share my screen to show you my reference manager. So all my references are in here, and I can search for keywords in there. And then if I go on to citation styles, so this is just a handful of styles. So these are my most recent ones that I've used. And Vancouver is one of those. So it's really determined by the journal as to what style they want, and that determines how the references look in the text.
Okay. So I hope that answers the question. So shall we have the next question, please?
Yeah. Get involved with people who've done research before. So, so the question is, your suggestion for fresh optometrist who wants to make research as their career option. Do little projects on the side, get involved with someone who's done research before. And a lot of us who are in more senior positions are always looking for people who are keen to work on research. and we will then support you through the whole process, give you on-the-job training and mentoring. So that is the best thing you can do. Don't try and do it on your own. And then if you're keen, like the more work you do, the more likely you are to be given the opportunity to have a first author paper. And as you build up your portfolio and present at conferences, then that's going to put you in a really competitive position to then apply for a research post going forward. Also consider doing a higher degree, so a master's degree or a PhD. But I would suggest, I started doing research right at the beginning of my career. So I graduated 17, 18 years ago. And even from my first job, I was working with some of the local doctors on their research project. And at the beginning, it would be just supporting them in data collection, then gradually building that up more and more. So that's the best way to go for it.
So I hope that answers the question. And these are only the questions that we have got from our attendees as of now. So considering the time limits and the health of our speaker, I guess these are the only questions that we'll be answering for now. But if you have any queries, you can kindly drop on our chat box. We will answer all your queries by forwarding to our speaker later anytime. Yeah. So with this, we are now to the end of the today's talk, and I would again like to express my immense gratitude towards our presenter, Dr. Jasleen, for her insights despite her ill health, and we wish her speedy recovery anytime soon. So before wrap up, anything you want to conclude, Doctor?
Thank you very much, and thank you all for your attention and your patience.
Thank you so much, ma'am. We greatly appreciate your efforts despite your ill.
Okay, so I can see the last question from the Manish Chaudhary. So he is asking for, can you please give a difference between the coherent study and prospective and cross-sectional study? If you can hear me.
Prospective versus retrospective, did you say?
Yes, ma'am.
Yeah, so retrospective study is using data that was previously collected, so in a clinical setting. Prospective study is you design your research and then you collect the data according to the very strict protocols. So both are valuable. With retrospective, you need to be aware, because you're relying on data that's already collected in a clinical setting, isn't necessarily standardized, collected by lots of people. The quality of the data is not necessarily so good. But if you're doing longitudinal work, sometimes you may have access to 10 years worth of information, and that's really important. So yeah, that's probably the key thing there.
All right, doctor. So I have also another question from the Srijan Lamisane. So she's asking for, if the journal asks for the abstract is 150 words in the initial process of submission, the journal, but again it asks for the multiple manuscript. So my question is, which of the abstract does journal use in the final publishing process?
So the final published article will always be the version after the peer review. So if you ever had to change anything, title, abstract, content, anything during the peer review process, then it's those changes that will appear in the final article. And when, it is frustrating, because when you're submitting the article, you often have to submit the same information multiple times, because you have your abstract uploaded as a file, but you also have to put it in the box, and sometimes in 2 different places. But make sure all of those are identical. You have to type in all your authors, as well as have them on your manuscript title page. But again, you need to make sure that everything you write is identical, and all the affiliations are correct, the middle initials are correct, and the author order is correct. And the middle initials are important because every author has a unique identifier. So it's called an ORCID OD. So you can register on, if you just Google ORCID, ORCID ID, then you can create your own. And then people who change their name, for example, if they get married, It makes sure that all of their information is together in one place. And if you don't have the name exactly right, then it's not going to pick up on that. So that's why it's really important to make sure everyone checks everything thoroughly.
All right, doctor. So I have one more question if you like to take.
Sure.
Yeah, so Satyam Portal is asking for how can we check or choose the quality of journal to publish the review article?
Not everyone will accept reviews. Some of the higher journals will only accept, will have to invite you for review. For a review article, unless it's a systematic review, you tend to have to look around for the journals. But I would just say, think about your audience. So we used to do a lot on impact factors. I don't think impact factors are necessarily the most important because they're always going up and down. And with everything being digital, it's not like people are receiving the print version very often anymore. So I think you just have to think about your target audience and who you want to read that review and try and choose a journal article accordingly. And usually your senior authors can help direct you on this best of all.
Okay, thank you so much, Dr. Jasleen, for all the answers and your time. So I guess we are now to the end of the talk. So Kapil sir, do we have any more questions?
No, Solo, no, we didn't have any more. Yeah.
Okay, yes. So thank you so much, Dr. Jasleen, again for your time. So here we are to the end of the today's talk, and I would like to thank you all for coming up with the questions and making the discussion session more interactive. So it's our immense pleasure to have you all join us this evening. With this, I, Solu Gautam, signing off from today's session, hoping to see you all again on the next one. Stay safe, stay connected. Thank you.